Welcome back to Wellness with Delaney. Today I am with Dr. Sanjeev, and he has a really amazing practice around biopeptides and biohacking, and just so much to say around this topic. You guys know I love a good biohacking episode, so if you do too, make sure that you are locked into this one. Dr. Sanjeev, thank you so much for joining.
Thanks for having me, Delaney. I'm looking forward to the chat.
So am I. So, can you tell me just to start a little bit about your practice and what you do?
Yeah, I'm a physician trained in Toronto. I run a longevity practice for the last 4 or 5 years. Before that, I was a family physician for about 20 years.
Amazing. And what is kind of the primary focus? Like what do patients come in to see you for specifically?
People are generally coming in because they have, generally want to get in better shape. To be
Mm,
honest, most people, that's the primary outward part of their body is the number one concern. So that might be putting on more muscle, or they want to lose some weight and make sure the insides of their body are okay as well. If they've got like a chronic illness like diabetes or liver disease or something.
yeah, absolutely. And I think weight loss and muscle gain, fat loss are obviously really important topics that a lot of people kind of get stuck on. I notice a lot of people who just really have a hard time figuring out the source of their excess belly fat or their inability to just get into the shape that they want, whether it's hormonal, a deficiency, just so many factors other than eating less and moving more, right? So if somebody were coming in and they're struggling to lose weight and they're looking to you for that help, what would be some of the first interventions that you would kind of explore with them?
We normally start off with doing pretty comprehensive blood work. And in that, we're trying to see, is there any signs of what's called metabolic syndrome? Metabolic syndrome means insulin resistance, and it basically includes high blood pressure, high cholesterol, fatty liver disease, diabetes, and obesity. All those things go together as metabolic syndrome. And when people have metabolic syndrome, it's really hard to lose weight because the body is kind of resistant to insulin. So insulin
Mm,
resistance is a very common part of that. So we
yeah.
try to assess that in the blood work first, and if people are having that, that's metabolic syndrome is extremely common in today's culture and lifestyle and all that. And then we try to help people's. We try to improve on that metabolic syndrome by lifestyle first, fasting and eating low carb diets, and then obviously exercise, and then obviously we have now amazing medications in this space as well.
Absolutely, yeah. And there's so many different, I love that there are so many different avenues we can take now that really do address the metabolism and all the factors in there versus just traditional weight loss methods that maybe 50 years ago we didn't have all this information in the mainstream. With fasting, are you a proponent of fasting for everyone, men and women?
No, I think there are cases when certain people shouldn't be fasting. Like, let's say if you're pregnant or you're a young teenager or something, and you're already relatively underweight, you probably shouldn't because you're rapidly growing. But I think most people could benefit. I think it's a very healthy thing, and it helps your body understand what to do when there's no food around. And it's like exercise. I think if you train your body to have these periods without food, then it becomes easier, and your body knows how to move between burning fat and burning carbs for fuel.
Hmm. Yeah, absolutely. Yeah, there have been seasons in life where I've gone really heavy into fasting, and then seasons of life where I haven't. Right now, I'm not really doing a ton of fasting, but in the seasons where I would do the more like 20, 30 hour fasts, I was all about autophagy. And I love autophagy. I think it's so fascinating. Can you, from a medical perspective, break down what's happening in your body once you hit that autophagy stage in fasting?
Yeah, sure. So autophagy means self-eating. Auto means self, and phagy means eating. So what happens is that the cell has two major mechanisms of nutrient sensing. So it's always trying to figure out, is there enough food around or energy, or is there lack of energy? And most people, because of we're constantly around food, are the cells are thinking that there's a lot of energy around. So when there's a lot of energy around, it's constantly growing. There's this signal to keep growing, and with growth happens waste, and sometimes growth can also be increasing fat or whatever. Like it doesn't. It's not always a good thing, and life is not always about growth. So it has to be balanced by times and periods where there's less energy. So when the cell has less energy and senses that, then it activates certain pathways, cellular pathways that help autophagy, which means getting rid of waste and dead products and dead cells that are close to dying, and things like that. It's better to get rid of those things so that the cell is more efficient. It doesn't
Hmm.
need to. Sometimes a little smaller or less means that the cell is better able to use energy properly without wastage. So it's like
Okay.
when you're let's say not eating a lot or whatever, and you go without food, your body in effect becomes more efficient, and you actually burn off extra fat that you don't need and things like that, and your body may be more metabolically efficient at how it uses energy. So the same things happen at cellular level, and there's two pathways. One's called the AMPK pathway. That's the one that gets activated during fasting, and then there's the mTOR pathway, which is getting activated when there's a lot of food around or a lot of energy around. So that's the basic kind of premise that people should think about, and in day to day life, like it's constantly the cell is always moving between these two pathways.
Hmm. What are outside of weight loss? What are some of the physiological benefits of getting into autophagy and fasting?
I mean, I think that it's it may have longevity benefits too. Like we know that caloric restriction leads to longer lifespan for organisms, including humans. So having less food around just generally makes the cells more efficient. They live longer. Um, Less damage is occurring because of just living. So it probably has other health benefits again that way. So it's not just about weight loss. I think even if you're a thin person or a lean person, you should still fast because it may have other health benefits.
Definitely, yeah. And I think that, okay, this is actually something that I've had a lot of questions about that I see a lot. And I'm like, okay, intuitively confuses me. So obviously with fasting, right? Like you don't want anything with calories. So you would be like water, like black coffee, which I don't try to do black coffee when I'm fasting just because of the gut component.
Mm.
But you're not wanting to take anything in. And then I see people doing fast with like bone broth or juices, things like that. Is there a benefit to that? Because I feel like whenever I would do that before, I just spent the whole time hungry because I was never getting into autophagy. So I was actually just more miserable versus if I just did water.
That's a, yeah, very interesting. Um, I guess the thing is that um it's how fast you want to get into autophagy, right? Like you could
Hmm.
play around and make it smoother by using things like bone broth and all that, because there are a little bit of calories and maybe some protein there, which is making things a little bit easier. So it's not such a hard, uh, fast movement to autophagy. Um, yeah, I think juice probably wouldn't fit because that's a lot of empty sugar calories. I'd
Yeah.
say that probably is going to really prevent you from going there. But if you're taking a very small amount of bone broth, I don't see that's a lot of calories. You probably could do that. Um, but I think yeah, if you're constantly stimulating with some amount of calories, then you're going to get the hunger pangs, and you're
Hmm.
just going to be suffering more. So sometimes it is better to just like bite the bullet, completely avoid
Yeah.
eating, just have a water. But at the beginning, for most people, that's quite difficult. Like until their body's been trained to do that, it's hard.
Yeah.
The hunger is a lot for a while. I remember once I did one of these like Prolon. I'm not sure if you're familiar with Prolon. It's
Hmm.
a 5-day fasting mimicking diet. And I remember just thinking, oh my God, after like the first day or two, it was extremely difficult. Like it was like I was dreaming about the little snack bar they gave you.
Yeah.
And I freaked out because I lost my 6 olives. Like it was, so we're not trained to do it, but I think after some time it becomes much easier. So it's sometimes better just get through the initial pain, and you're just much easier.
Oh, absolutely. Yeah, when I first started, it was so hard. And that's where I was like, okay, so the first 17 hours would always be really hard. And once I hit hour 17, it was always like something magical happened. So by the time I hit hour 24 or 30, or however long I was doing it, I wasn't even hungry. A lot of times I would do like a coffee enema to end it. And I'd be like, I could probably go another day and I'm not even hungry. But those first 17 hours were brutal. But then I realized I was doing things like putting cream in my coffee, having some bone broth, having things that were making me more hungry and keeping me from getting to that zone where your body now isn't craving food all the time. So I was like, these juice cleanses are not working for me.
I don't
They're
think that.
not
I
making
think
sense.
juice cleanse would probably not work. Yeah, that I think
Yeah.
works for sure. It's like sometimes I think about it with my dog. Like for example, like if you hand your dog food, then it gets more hungry. Dog's more
Hmm.
hungry. Like wants even more stuff. Like it's like you're activated. All of a sudden, it's thinking about food.
Yeah.
Same thing I think happens with humans too. Is we're just not used to it. We always have food around, but it's probably good to have those breaks, and it becomes a lot easier. Like
Yeah.
I think constantly snacking is probably not the right advice. We give people, we're always telling people, yeah, keep snacking, but I'm not sure that's necessarily the best thing to do.
Yeah. I don't like snacking so much. I feel like like I love the micro fasting throughout the day, like a good at least 3 hour window.
Yeah.
Granted, there might be a coffee with some milk in it in that, which I know is not technically fasting, but it I feel like it just my stomach is better. I'm less bloated. Like I'm not constantly digesting something. I even stopped like chewing gum just to like let my body rest.
Mm.
And that's been really profound for me. Do you think that people can overdo it with fasting?
Yeah, I think again, if you're already a lean person, then there's a point where like it could you might have a problem putting on weight or like keeping muscle on. Like it's not just that it could take away fat over time. It can start to eat into muscle too.
Mm,
I mean,
and that's
why?
scary.
Yeah, why does Ozempic? Why do we see with Ozempic face or whatever? I mean, why that
Hmm.
happens is that people are losing weight, and they're not just losing fat. They're losing fat, but they're also losing muscle. And one of the
Yeah.
biggest things we see is that people are losing a lot of muscle on these type of medications because they're not eating enough protein. So
Mm,
yeah, I think it's good. You can do some amount, but you have to also you can't constantly be in calorie deprivation.
yeah.
Yeah,
Definitely. It's like fasting without feasting is starvation.
yeah,
And then I'm like, I see some people do it. I'm like, I think you're just not eating.
yeah.
I mean, you gotta eat.
Yeah, you got to eat exactly because that's what we're meant to do. We're supposed to eat, and then we're supposed to like stop eating. That's how body's made for.
Yeah. I think there's some level of like ancient intuition, right? I think about like nomadic people, right? They probably would hunt a big animal, feast on it, and then who knows when their next meal is, right? And so it's kind of like that's how things used to be. And now we just have so many modern conveniences that make it feel crazy to not eat every 2, 3 hours. But I think it's really interesting when you realize like we didn't always have packaged foods ready to go at any given notice, and we don't necessarily always need that. For somebody who's, let's say somebody is not pregnant but they're working on fertility, can fasting impact someone's ability to conceive?
I think. Well, we don't exactly know the answer. I would say, as an educated guess, that if you fasted too much and were on the low side of your body weight, it could impact your hormones.
Hmm.
So you could think about it that the body would not be concerned about making a child or whatever, if there's not enough energy around, it would focus on just like conserving the body. But I think if one's not in that situation, some fasting might make the system more efficient and maybe more likely to have a baby. Like I think that's more for a chance to be fertile. So it's probably a sweet spot there.
Yeah, where it comes to, I guess, get that blood work with somebody who knows what they're doing, because it's the Wild West out there when you're just trying to like follow Instagram trends, right? And do it on your own. I think it's really important to have someone on your team that actually will like team
Yeah,
up with you and know what's going on.
like one of the top things I tell people on the blood work to test, and most people don't get it tested, is fasting insulin, and
Hmm.
just to see what that number is. And if you're doing if you're metabolically fit, you're less than 30
Hmm.
on that. And I see a lot of people are like 100, 150.
Wow.
But this is where like they may have a completely normal sugar, but they're very high risk for getting diabetes in the next 5 years. So,
Interesting.
and you could have a complete normal sugar and have no idea, and you go to the doctor and like, oh, this is perfect, everything's great, but you already have insulin resistance happening if your insulin
Mm.
fasting is over, let's say, 60.
Wow. Okay, so then with this, do you see that a high like a do you see these numbers more with people who have a higher like amount of body fat, or are you seeing it with lean
Yeah, for
people as
sure.
well?
Yeah,
Okay.
because the body fat is a reflection of insulin resistance.
Mm,
So almost everybody who has increased body fat has some insulin resistance going on.
gotcha.
Yeah, and so you can see that in the blood test and see what's happening. Um, I also did again some blood test on dogs, and their insulin fasting is generally above 5. So it
Hmm.
tells you that you know an animal that which eats hardly any carbs, generally, can doesn't need to release that much insulin, and that's a very healthy metabolism. That's why you don't hear about dogs getting diabetes or heart disease.
Mm,
Uh,
right.
but unfortunately, a lot of animals these days are also overweight because the owners are feeding them all types of food, all times of the day.
Yeah, I really want to dig into like holistic animal veterinarian eventually because I'm just looking at the way people are raising their animals, and I think a lot of times the way they raise their animals is also a reflection on their own lifestyle. Like,
Hmm.
personally, my dog's on a raw diet and is just so healthy. Like, she's the leanest little muscular pookie you've ever seen. And I've actually gotten some help from vets trying to get me to put her on like the kibble, like the Purina kibble. And I'm like, no,
They won't. I don't
absolutely
know why
not.
they want to put you on kibble. Yeah, we did Ross for quite a bit of time, but now my wife basically cooks like a stew for that dog every day.
Yeah,
That's works very well. But yeah, I think there's a lot of problem with the type of foods that we're feeding the animals, especially all that processed food.
absolutely. When I think about it, like it's the same thing. Like, would you open up a bag of chips, just like fried in seed oils, processed like every single day, every single meal? And I'm like, we were not meant to eat anything dried and processed with oils and additives for every single meal. It just absolutely blows my mind. And I think that comes down to the care we need to give ourselves. Like, if we think about those that we love, would we not want to provide that same level of care for ourselves? And I think that obviously diet is so important. And for some reason, people really don't want to give up their processed foods. And that's really like something I'm trying to address with people now is just really teach them that it's not that hard to eat a clean diet. You just need the right tools and you just need like a window of learning and being able to explore and learn how to cook and just make things for yourself. So I know.
I think this processed food is a huge thing. Like when people ask me how they should eat, I don't think it's about being any more vegan or
Hmm.
carnivore or whatever. I think it's I think it's about just reducing processed food,
Yeah.
ultra processed food actually. That's what's been linked to excess weight gain is processed food.
Yeah. From a molecular standpoint, like what's happening in someone's body when they're eating seed oil laden foods?
I'm not an expert. Unfortunately, I'm not an expert in that area, so I may have to pass on that question. But I can just tell you that a lot of these um molecules found in processed food act as hormone disruptors,
Mm,
estrogen mimickers, and they also impact like this insulin, like the way insulin is being processed,
yeah.
causing insulin resistance. So that's probably what's going on, because there's such dense calories, so much calories happening, and the body's just not used to that because never seen that before.
Yeah, absolutely. So for somebody who, let's say somebody's coming to you and they are struggling with insulin resistance and, fasting aside, what would be some other lifestyle interventions that you would recommend for them just in their day-to-day outside of medications?
Well, I still obviously it's still important to get active, like, and if it's not some amount of general amount of walking is very important, like just being generally active. And if one could do, then I would say like something like high intensity training was very useful because it's been shown to have a lot of health benefits. Um, And then apart from that, I would say that understand their cravings. Like I usually tell people to start recording what they're eating, and most
Mm.
people don't really understand what they're not really aware of it. So there's so many apps out there that help you just take pictures and it automatically tells you what you're eating and counts your calories. And I think that's a very useful thing for people to do because then it brings everything into awareness. They understand, oh, I'm really eating this thing. This is how many calories I'm having, and this is how much processed food and all that. So I normally try to get people to do that, and that in itself, you start to understand patterns about how late are people eating? Are they snacking in the middle of the night? Are they having you know extra junk food or whatever? So um, sometimes people have a craving issue that they need to deal with, and that can be helped with various treatments. In our clinic, we offer something called transcranial magnetic stimulation, which is it's basically magnetic brain waves that are stimulating a certain part of the brain that's related to cravings and binging. So, you know, that's something probably worthwhile considering if you're trying to get a handle. If some people say that they're not eating well, it could be just that they're not aware of it.
That's really interesting. So, using brain stimulation specifically, I love the idea of for binging. How does stimulating your brain lead to a reduction in binging tendencies?
Yeah, so the left dorsal prefrontal cortex right here um, is the part of the brain that's involved with, let's say, mood regulation and executive functioning. So when we have anxiety, depression, these things are being monitored up in that part of the brain, and that's where rumination's happening. So ruminations, we're constantly thinking about the same thing over and over. That's what's seen in depression. And in binging, that's also a lack of, I guess you want to call it control, because that part of the brain is not as developed. So what happens is that, like exercise, we send electromagnetic waves through this machine that just sits right over above the head. It doesn't hurt. It takes about half an hour, and it's sending pulses to stimulate the neurons to fire. So when you do that, it's like exercise for those neurons. So the more that neurons fire, that's the more they get stronger, more connections form. And so this treatment has been around for 40 years,
Wow.
transcranial magnetic stimulation, but it was a very expensive treatment. And because of that, nobody really was offered this treatment. It was also more cumbersome and all that, but now it's more available in clinics. And so something to consider instead of you taking medication, something to use
Yeah,
because it does work for binging.
that's really cool. And then I'm curious, so you mentioned because it's about, self-control also, right? Do you see that often people who come in for binging see that they're more disciplined and self-controlled in other areas of their life as well?
Yeah, I think that it's this is I guess it's a there's a sense of wanting to control something, you know, and binging. I ultimately I think this is a mood and anxiety issue
Hmm.
that somehow got out of control, and that part of the brain is just not working as well.
Yeah. That's so fascinating. That's a really cool treatment. And I love to hear. I mean, I think lately we've been also learning that like binge eating and these struggles with foods aren't just something that are inherently within us that we have to muscle through the rest of our lives. And knowing that there are actual treatments and interventions and just lifestyle tools to help mitigate that. Even things like for me, so I used to really struggle with binge eating when I was younger
Mhm.
and like binging, purging, all of that. And one thing that really helped me in my adult years was just making sure that I'm always starting my meal with protein. Something as simple as that helped me because I wasn't starting my meals with blood sugar spiking, right? And I stopped snacking on carbohydrates, and that just that simple thing helped me be able to like hear my hunger and fullness cues a lot more clearly,
Mm.
and it was dramatic. So I think that that's something that's really helped me just managing blood sugar. And I know that we kind of talked about blood sugar and insulin, and I'm curious about your thoughts. What are the roles that blood sugar plays in people's struggle with food and weight?
Yeah, that's a very good point. I'm not 100% sure how blood sugar. I mean, it does. You people talk about blood sugar dropping. You know, and you see that. Okay, if you could kind of imagine why this might be happening. I'm not sure if anybody's proven it, but with people who have, let's say, the early signs of insulin resistance, or they're having some carbs and simple carbs, let's say, like you're saying, something that's like a sweet, then there's basically a rise in insulin right away that happens, like a spike. And that insulin will right away drop your sugar down really quickly. And that will obviously send a signal to your body that I'm hungry. So it becomes a vicious cycle. So if you eat foods that are just going to like cause this yo-yo, then that's why it's going to feel very difficult. Like, we're all human. Like, if these things are brain is developed to respond to these type of cues. If the sugar's going down, body's saying I need food, more food.
Hmm.
So I think it's a very good point that like protein is a much slower rise in sugar, and it's filling up your stomach, which is then sending signals about to other hormones that you're getting full and you don't need to eat so much. So I think it's a very good. I think it's a very good strategy.
Yeah, it's something that's really changed my life. And I'm always telling people, I think in so many ways, and it may be not always like if I eat a big, meaty egg breakfast, whatever, like a pile of ground beef or something for breakfast, I can go 6 hours without even thinking about food. And that's something that I never would have experienced before. So that freedom to live life without worrying about food
Hmm.
is it's so nice. I used to always like hyper fixate on my next meal, my next snack, what I wanted to eat, what I was craving, and just to like have it gone out of my brain from something so simple has been amazing. So I know that you have a lot to say on different like biohacks and ways that people can up level their health, and I would love to hear from you what you think are the most overrated and what you think are the most underrated biohacks, because I know some of them I just think are not worth it or can go crazy, and some of them are so simple yet so effective. So let's start with, what are some of the biohacks that you just think are overrated and you're not a big fan of?
Hmm. Interesting question. Um, a lot of people take a lot of vitamins. I'm not 100% sure how much impact these things have, especially general multivitamin. Most of this can be found in food, especially if you're eating properly. There's no real reason for many of those types of supplements. Um, yeah, I mean, you may have to give me an example or ask me. I don't, some like I think it's a question that for a vast majority of people, if you're just doing well, many things don't make that much of a difference. Like, they're not going to
Mm.
make that much. You're not going to get that much bang for your buck. So, like, for example, I don't know if you're like you want to get an intravenous IV drip, getting a multivitamin IV drip probably not going to make a massive impact.
And they're
Unless you have some
expensive.
issue. Yeah, and they're expensive. But let's say you have fatty liver disease and you want to help fix that, then it's not a bad idea to get a phosphatidylcholine IV, which is going to help get rid of the fatty liver. So, like, that's an example. What I mean,
Gotcha.
you're on like you've had a lot of alcohol and you're concerned about detox, then not a bad idea to do a glutathione IV.
Mm.
So you have to kind of match like what is the person trying to deal
Yeah.
with, right? Most people things are they're smooth. You don't necessarily need to change anything with that. Um,
Yeah. With NAD, I'm seeing a lot of celebrities and healthy people doing NAD IVs. I've even taken NAD before. What are your thoughts on that?
No, I think NAD looks like there's a lot of science behind NAD, but it's not something you're going to see an immediate response. And it also, the older you get, the less NAD you have in your body. So
Mm.
if you're older, then probably more benefit is going to happen. But if you're a younger person and you're doing really well and you're eating well and you're exercising, you already have NAD in your body. So I would say again, if a person's unwell, um, potentially they're struggling with low energy or some infection or something, then yes, NADs I think could have a very big role.
Hmm.
Yeah.
Absolutely. Yeah. And I started taking it in my younger 20s, and I'm going to be honest, I didn't feel that much of a difference. Like I wanted to, like You know what I mean? Like I wanted to feel a huge
Yeah,
difference, and I was like, I
we
think
want
this
to
is
feel.
good.
We want to notice these things exactly.
Yeah,
But
yeah,
I mean, I can tell from all the people we see, we don't see it. There's certain people who feel it, and they have chronic illnesses.
yeah,
They have things that need to be fixed, and so energy is very powerful. Like
yeah.
it's basically the energy molecule to fuel your mitochondria.
Yeah, absolutely. Yeah, I'm a big believer in it, but I was like, I don't know. What about, I mean, I guess that's kind of the same thing for like if I were at this age in my 20s to start taking senolytics, right? Are
Yeah,
you,
I think it's not going to have much impact because you don't have many
yeah,
cells right now.
right.
Yeah,
Exactly.
if you're 50, then yeah, then I think it may have more benefits. So we're still in a very early stage to understand what are the senolytics that work and what's the cocktail. We don't really know that 100%.
Mm-hmm.
You know, one of the supplements out there that we make is something called Fasting Pro, which is basically a supplement that stimulates this senolytic pathways and autophagy pathways. Uh,
Cool.
a lot of these molecules, like spermidine, have been around. There's some research showing that they help, but we don't 100% know, um, for how long, and what's the right age to start it at.
Yeah, absolutely. I'm hoping by the time I'm ready for senolytics that there's a lot of research around them because it's something I definitely have my eye on. And I think it has potential to be amazing for anti-aging, but obviously it hasn't been, it's on my radar, but it's not something I've really dug into because I just have no need so far. But I'm hoping in the next 10 years that there's a lot more information out about them.
Yeah, I think what people could be looking forward to things like exosomes, which
Hmm.
you know,
I don't even know what exosomes are really, if you want to tell me about that.
yeah, exosomes are like this inside signaling packages that cells release, stem cells release. These little
Hmm.
they're little, like, let's say, packages of growth factors and signaling molecules that lets them communicate with other cells. So now you can just now various number of companies that produce exosomes for topical,
Hmm.
and it's potentially able. I'm not sure where the FDA. I think it's in certain clinical trials where they're doing exosomes for like injections and you know injection to the face and things like that.
Wow.
And seems to be doing very lots of promising effects from that. So there's no live component to it.
Really cool. Okay, so for the face injections, is that like a Botox alternative or is there a different purpose?
No, like basically these exosomes are going to go and make your face younger and
Hmm.
improve collagen. Like it's in effect
Wow.
like a vampire facial, which is like PRP,
Mm.
which is your own growth factors in your own blood is now being injected to your face. But exosomes are consider that like 20 times more powerful
Wow, that's so cool.
because they're using like stem cells to release these growth factors, which are then being injected into your face and all that.
Really cool. Yeah, I'm excited to hear more about that and see kind of the research come out around that. It's cool to see how many treatments that are non-toxic but like really cool and effective for beauty and anti-aging are also coming out on the market because I think it's never been easier to look your best at any age without having to go the Botox filler facelift route. There
Mhm.
are so, I mean, I was just talking about this on another interview where it's like there's lasers, there's microneedling, there's exosomes apparently, right? There's so many things that we can do to preserve longevity that are more naturally based. And I love to see research in this direction. I think it's so important because then you really can have your cake and eat it too. I love learning about this. It's really cool.
I'll just put a plug in for a company. It's called Acorn. They're in Toronto, and I think they're available in a number of clinics in the U.S. as well. But it's called Acorn, and what they do is they take 50 of your hairs from the back of your head, and there's still stem cells at the end of it, and they go and grow those stem cells, and then they give your doctor your own exosomes.
Wow.
You have them for life, like in effect. So it's something that the viewers can or listeners can look up. This is not possible. That they can get their own exosomes. There's no risks there, and they're offering that type of treatment.
Really cool. Yeah, definitely. I'm going to be looking into that. That's really fascinating and worth digging into. Okay, so what do you think about cold plunging as a biohack?
Yeah, I think cold plunging is very good. Decrease inflammation, probably. Whether it's going to make you lose weight. I'm not 100% sure, but no, I think it's very good. Again, probably what's happening is that like alternating between sauna and cold plunge, these are very good things because it's like exercising the your temperature regulation system,
Hmm.
and that's a good thing because it's again it's helping your body move between these things, and I think that's generally very good for the system.
Yeah, absolutely. Do you think for women they should be cold plunging less cold than men?
I don't see any reason why they have to do that unless they're
Mhm.
maybe pregnant or something. I don't,
Gotcha. Yeah, there's been a lot of controversy around cold plunging lately, and I hear so many different sides. So I love to always kind of
oh, interesting. I
get all
wasn't
the
aware. I gotta do some reading on that. What's
yeah,
the reason why they're saying that women should not do as cold? What's the reason behind that?
for hormones. So let's say for me, this is kind of my what I've been doing lately, but I always go more intense when it's fasting, cold plunging, anything that's gonna working out, anything that's gonna put stress on my body
Mhm,
during like the day 5 or 6 of my cycle up until ovulation.
mhm,
And then after ovulation, I'll do more gentle. So I might scale down to just like a regular, 12 hours at night for fasting or more gentle workouts, Pilates. And then, like, if I'm cold plunging, maybe 50 degrees or just not at all. And
interesting.
so, a lot of the philosophies would be that when progesterone is higher,
Yeah.
we want to keep cortisol lower.
Mhm.
So, I don't know if you have any thoughts on that, but it's a very women niche thing. But I'm always trying to get all the answers because it's everyone has questions.
Yeah, it kind of makes sense to be honest, because the second half of the cycle is more of a care, like the recovery part of the cycle, because the body's kind of getting prepared for if there's a conception happen or not. So
Yeah.
it kind of makes intuitive sense.
Yeah.
I didn't know any science behind it, but it sounds like a good idea. A lot of people are not aware of their cycles, and
Hmm.
it's good to be aware. There's lots of rhythms happening. Or
Yeah,
not.
it's a vital sign of health. It's so important for women to understand.
Mhm.
Absolutely. Okay, so let's go into some of your favorite biohacks. What are some of the ones you can't live without?
I'm a big believer in blue light blocking glasses. I use them pretty much every night, and yeah, I think that has a massive impact. I think sleep is super important. You know,
Yeah.
I think that there's lots of supplements out there that are, that can help in improving sleep quality. I use a brand called Eons, which is like a sublingual um, dissolvable pill that basically has melatonin, theanine, magnesium, reishi mushroom. But people can choose any one of those. I mean, probably a good idea. And yeah, I'm all about certain peptides. I like peptide BPC 157. That's one of these. It's called the Wolverine peptide. It's a super regeneration peptide and good for like gut health. Obviously, mental health is super important. I try to like have some quiet time every single day. That's,
Yeah, absolutely. I love, Kate, the mental health component, just having quiet time. What does that do to your body physiologically when you can disconnect mentally?
well, I think the stress hormone. That we're living constantly in stress, so it's important to like give your nervous system a little bit of a break. Um, so I think that we call that the parasympathetic nervous system. That's the one that's going to help with your digestion and getting your heart rate lower, getting your breathing deeper. I think all that just I think it's really important. So
Yeah.
yeah, I think everybody should do that. We probably don't do enough of it.
Absolutely. Yeah. I even find myself there's like a level of sometimes when I'm not busy, if you're in this rhythm of busy, 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 it's like you don't know how to rest. You don't know how to be still. So like when I have the chance to rest, I might be on my phone or finding something to do. So it's almost like a discipline. Like you have to actually be intentional about resting and doing nothing. And I think that's really interesting in today's busy society, how we're often just trying to stay busy, stay stimulated. And I don't know about you, but if I'm doing that all the time, I feel absolutely fried on every level, like physically, mentally, emotionally, spiritually, where I'm like, oh my gosh, I need rest. I need to like do nothing and close my eyes for a minute.
Yeah, I like this term, dopamine fasting. I like
Mm,
this idea that, and it's extremely difficult because we're not trained to do that. But you're right, just doing nothing, no stimulation, and seeing how that feels. And I think it's going to have pay a lot of dividends because once you do get restarting the stimulus, and then you're going to enjoy that more.
yeah,
What's happening is
absolutely.
that because we're so constantly stimulated, we need more and more stimulation just to enjoy regular life.
Yeah, absolutely. Yeah, because then it's like you're like it's that climbing, climbing, climbing of dopamine, and then you have no baseline.
Yeah, there's no, it doesn't, we're not resetting. It's like fasting. That's why I
Yeah,
call it dopamine fasting because it's like taking a break from food, but you're just taking a break from stimulation.
I love that. I found that because I feel like I just have such a busy bee, energizer bunny, like just mentality and personality to a fault.
Mhm,
I've learned that I have to like get help to rest. So some things that I've been doing acupuncture and that or if I can't get in acupressure with like the prana mat,
mhm,
and I think it gets me into like the theta or the alpha state pretty easily where I can just like be like that, not fully asleep, but kind of dreamlike
mhm,
state.
mhm.
And it's so restorative. Every time I come out of even 30 minutes on the mat, or if I actually go get acupuncture, I feel like a whole new person. I'm like, oh
Sure,
my
what type of
gosh.
device is this?
So it's a mat that you lay on,
Penf,
and
Penf.
no, this one is like spikes. So it's a bunch of tiny spikes, and the whole
Oh,
concept, yeah, where it's like you
okay.
lay across it
Yeah,
and it's
yeah.
like laying on the needles, but at home.
Wow, I've never heard that. I like to, yes. Yeah,
It's
I like
so
this. That's
cool.
very interesting.
It's so cool.
Yeah, I use another device, another hack that I really like is something called Brain Tap. Brain
Mm-hmm.
Tap is, I've never heard of it, but it's like binaural beats. And on top they have like a thing where it's flashing light, so
Yeah.
stimulating your pineal gland. Um, but you immediately notice a difference. Like each sessions are about 20 to 30 minutes, and most times you fall asleep because it's just so relaxing.
Yeah.
So the science looks really good on that. It can help improve your sleep quality, improve your focus, and things like that.
Absolutely. Is brain tap something you can do at home or is it something you go in to do?
No, you could do it at home. You just
Amazing.
can just go to the website, and I think you can just subscribe on a monthly basis. And if you want to get the headset, because you could otherwise just use a regular headphones, but if you want to get the flashing lights and all that, then you can get their headset and buy
Really
that,
cool.
and then just do it at home.
Amazing. Yeah, I definitely want to I am so curious about all the different like binaural beats, pulsetto, all these things just for your nervous system. I feel like that's my next deep dive. I feel like I just go through random rabbit holes of health. Like right now I'm on non-toxic clothing and activewear. And I feel like next I really want to go into the brain hacking a little bit more because I find it so fascinating and so powerful. And now even just prioritizing getting into different brain frequencies in small ways,
Mhm.
I just want to do it more because it feels like the ultimate biohack for just clarity and focus and mental health.
Yeah, no, I think there's even. I just came across one of these red light kind of like it's like a headband. I don't know if you've seen this.
Cool.
Is stimulating again parts of your brain with red light therapy, and also um, stimulating your vagus nerve so that there's decreased inflammation going on.
Yeah,
But
really neat. Yeah, I don't know if you've heard of Beacon 40, but I've been doing that. It's a 40 hertz lamp and it just flashes 40 hertz. And then the literature behind it is it signals through your optical nerve
Mhm.
for your brain to produce gamma waves.
Mhm.
So I'll turn it on while I'm working or passively, like if I'm watching a show or
Oh,
whatever.
wow.
And I try to do it for an hour a day, and it's supposed to get you into gamma more easily so that you can get into that kind of focus flow, but then also for sleep. I feel like I've noticed a difference. When I have it on during work, I feel like I get into almost like an Adderall level of focus, which is really cool.
So does the light look different, or can you feel the 40 hertz? Can you sense it? No.
You can slightly see it. So it's a little bit slower than the flicker of like a computer or a phone. So you can just, at first, I see it. And then after maybe 20 minutes, I don't see it anymore because my brain kind of resolves it, if that makes
Yeah,
sense.
yeah, it gets used to it.
Yeah.
Interesting.
But it's
Hmm.
really cool. I'm like, okay, brain hacking is definitely a rabbit hole that I want to go down. I just think it's so fascinating. And we have so many cool devices to help get into different frequencies, relax, get into parasympathetic. And I feel like spending time in that parasympathetic is not something a lot of people in our society do anymore.
Hmm. Yeah, that's crazy. I'm wondering about this 40. It's called Beacon 40.
Beacon 40, I'll send you the link to it. It's pretty freaking cool. I've been using it for a couple months and I think I've seen a difference. I really like it.
Hmm.
So I would love to know from you, being a doctor that obviously has a more lifestyle approach integrated with the medicine, integrated with the peptides, right? For you, what would you ideally want the future of medicine to look like between patient and doctor?
You know what? I mean, information is becoming so available now that I think it's difficult for doctors to keep up with knowing everything. I think, in the past, people looked to their doctor to provide them all the information and tell them what to do.
Yeah.
But really, it's changing. That's paradigm is changing now. So I think it's more like doctors are more like guides. Maybe they can give some advice, especially more medical things that are uh, management diseases like diabetes and so on, things like that. But we want to keep people more on the wellness spectrum, and so I think, yeah, doctors are more as guides now, and patients, people take charge of their own health. That's why I think biohacking is really the wave of the future now, and you can see so many things are happening outside of the doctor's office.
Hmm.
For example, you don't need to go to your doctor's office. If you can keep you healthy, you hopefully never need to go there.
Very true. Yeah, it's pretty cool to see like the insourcing, right? Where I feel like doctors and patients now are becoming more of a team,
Yeah,
and I love to see
changing.
it.
It's not just a one way telling the patient what to do. It's much more of a team effort and listening. Understand where the
Definitely.
patient's at. People have different goals and try to see where they're at and where they're trying to get to.
Yeah, I really like that. I've been referring to my different practitioners as kind of my healthcare team because it feels collaborative. Like between I have a traditional Chinese medicine doctor, I have a naturopath, and a chiropractor, and I feel like it's a collaborative effort, right? And it feels like teamwork. It feels like collaboration. I actually just was with my TCM doctor yesterday getting acupuncture, and we talk about like he's like, hey, I want you to go to the store and get bone marrow and start cooking that, right? Like I want you to start trying this, and it's there's back and forth, and it's kind of like, what are you willing to do? How far are you willing to go? And we talk about it. And I think that's a really beautiful shift versus treating doctors like it's their job to fix everything with the prescription, right? It becomes this collaborative effort. And I love to see it. And I love to see power being put into the hands of people as well as they're educating alongside their doctors.
Exactly. No, I think that's happening. You're seeing that, especially with people who are more educated.
Absolutely. Well, Dr. Sanjeev, what is your biggest health goal right now?
My health goal. I'm working on the speed of aging. For Brian Johnson who's doing that. He's obviously trying to stop dying.
Trying to live
But
forever.
there's a test out there called the Dunedin Pace of Aging, and it's basically how fast are you aging. And
Mhm.
my goal is obviously to get that number as low as possible. Currently, I'm at 0.71, which means I'm aging at zero point 0.71 as compared to a normal person my age, which is
Incredible.
pretty good. Yeah, so I'm working on that. So whatever it takes to get there, that
Yeah.
means really cutting down alcohol and making sure I'm sleeping well, and getting my nervous system in a relaxed state, making sure I run a few times a week and play soccer and all that. So I think that's pretty much my goal. I don't have a goal apart from
Amazing. No,
that.
that's amazing. Where can people find you?
I'm at sanjeevgoyal.com or peakhuman.ca. Those would be the two places people can find me.
Amazing. Well, thank you so much. I loved chatting with you, and I feel like I learned so much and have so many things now I want to study and go research and look up because we just have so many little tidbits of fun biohacks that can make your life so much better. If you guys love this episode, make sure to share it on your stories, tag Dr. Sanjeev and myself. Let's get this word out there. Thank you so much for coming on the show today.
Thanks, Delaney. Thank you so much.